does Gen Z look so much older than their age?
Everyone is talking about how Gen Z is aging faster than millennials.
You guys, I have so intentionally stayed out of the do Gen Z look older, millennial look young debate because, like, as a Gen Z, I know that millennials look young.
I mean, some people just genetically look younger, and that can happen whether you're a Gen Z or millennial. It really depends on your genetics and how well you take care of yourself. And of course, stress, happiness, sadness can make a difference depending on the moment.
Remember when Kylie Jenner almost broke the internet because she had the audacity to turn up to an event looking like this? If you're wondering what the issue is, I don't blame you. To most people, she just looks like a beautiful woman in a beautiful dress. What is the issue? Well, the issue, my friends, is that Kylie Jenner was 26 here. And according to the internet, she did not look like a 26-year-old. No, according to the outraged folks online, Kylie looked old.
According to the outraged folks on the internet.
Like a beautiful 45-year-old lady. No, wait, sorry, make that a 50-year-old lady. Is this what filler and Botox looks like? Asked one bewildered fan. Other horrified people claimed that Kylie looked older than J-Lo. And J-Lo is 53. Millie Bobby Brown, remember her? She's another one that apparently looks way older than she should. Fans were utterly outraged when they saw these pictures of her attending the opening of her new Netflix show, The Electric State.
I don't think fillers account for all that. She just has a maturing face.
With her husband, Jake Bon Jovi. She looks like his mother. She looks like a 40-year-old. Which again, wouldn't be a bad thing. 40-year-olds are hot, except that Millie Bobby Brown is only 21.
Why does 21-year-old Millie Bobby Brown look like a middle-aged woman?
Also, gaining weight could fill out the face more, making you look older than you really are.
Hi everyone, it's Millie. I want to talk about some of the articles that have recently released. One article reads, "Why are Gen Zers like Millie Bobby Brown aging so badly? Millie Bobby Brown mistaken for someone's mum as she guides younger sister Ava through LA. I started in the industry when I was 10 years old. I grew up in front of the world and for some reason, people can't seem to grow up with me."
And she's not the only Gen Zer to apparently be aging like milk.
I think there are millennials who age like that as well, so I'm not buying into the whole Gen Z millennial argument here.
Does Gen Z look older than they should? As a generalization, yeah, they do.
No, they don't.
Respectfully, you look like you're pushing 45. Stop getting filler or Botox, whatever you have. It looks so bad.
So I think if too much filler and Botox, it can give you puffy face, especially if you gain a little weight, it can make your face bigger. On top of that, it's all additive. And so a heavier face like that can make you look older or age more.
Now, before all you Gen Zers go shouting at me in the comments and cancel me, hear me out. It's not that the younger generation is rapidly aging due to their shitty genetics and us genetically superior millennials are aging slower. The reason that Gen Zers like Kylie, for example, look older than their age, I would say is probably due to the very tweakments they're doing to look younger.
Here's some things that I do to slow down the aging process as a 14-year-old.
I'm doing most of these things at 12. I use a retinol twice a day, and one of my favorite tips is I get my body lotion and put a little bit in that, and then apply to my body as usual. I do 2 face masks a day. I always use selective essence all over my body. I leave this face mask on for around 10 minutes.
Never forget to do skincare on your neck, because that's one of the main things that ages.
So I think there are some people get carried away with all this and take it overboard for sure, but I don't think you can say that about the general population.
If Gen Z does in fact look older than they should, I think there's only one thing to blame. And I would point the finger at all of the tweakments the beauty industry has sold them. Like Botox.
There's a lot of things you can blame it on. That's probably one of them, but it's definitely not all of them.
This idea that females should start getting Botox as soon as it's legal to do so, I'm talking late teens, early 20s.
I agree with that. I think that's a little bit too young to start. This idea of preventative with Botox in your teens and 20s, I think is just a marketing ridiculous thing and people taking advantage of you. It's important to go to a certified professional like a doctor, a licensed doctor, like a plastic surgeon or dermatologist to get real advice.
The problem that we're only just now starting to realize is that preventative or baby Botox, as it's being marketed to attract the younger generation,
a marketing term that I truly do not appreciate when it comes to Botox marketing is the term baby Botox.
I totally agree with that. It's a total marketing term.
Botox is actually making us age faster. What's really happening with all these 3-monthly Botox injections into young faces is that all this Botox is having the negative side effect of weakening the facial muscles. And you do not want weakened facial muscles.
So if you're trying to paralyze everything on a regular basis, yes, it can weaken your muscles. That's why you want to put the correct dose in and you want to have some movement, but enough to diminish the wrinkles.
Your Your facial muscles, the same as any muscle in the rest of your body, needs to stay strong. If you stop using any muscle, it will become weak. And if your muscles become weak, they start to shrink. So if you keep getting Botox over and over and over, like every 3 months, as soon as you notice that you can start making facial expressions again, off you go to your injector. Especially when you're young, your muscles are slowly starting to atrophy.
Once again, if it's done in the right dosage, you're fine. So you can go every 3 months, but what she's talking about is basically flooding the area with Botox.
Which in layman's terms means that these muscles in your face slowly start to waste away because they are not being used. Think of it this way, right? Those muscles under your skin are like scaffolding, holding the rest of your face up. If this scaffolding becomes weak and starts to shrink, what do you think is going to happen to the skin above it? That's right, guys, your skin is going to start to sag because there's nothing underneath it holding it up. And what is sagging skin often connected to? Aging.
Well, it's not necessarily true. It's not just the muscles that hold everything up. There are other structures there as well. So muscle is definitely part of it, but not the total answer to that.
This is why when you look at women who allegedly have been getting Botox for a long, long time, their skin appears a little thin. You can see the veins in their foreheads.
So these people are thin to begin with, so you can't contribute all that to Botox.
But in an effort to slow down the aging process, it turns out that we're accidentally, inadvertently, speeding it up and paying for the privilege.
So she's not showing one relatively obese person that has thinning skin on that forehead.
As we all know, Kylie, like a lot of us, had been getting filler from a very young age, 18 I think. She started with entry-level fillers, aka lips, and thus began the era of the lip filler. Lip filler popularity exploded overnight. According to one study, we are talking a 3,233% increase in popularity. That is not a beauty trend, that is a full-blown cosmetic pandemic. Kylie did not just stop with her lips. Suddenly, we wanted everything bigger. Bigger cheeks, bigger jawlines, bigger bums.
So these are a lot of extreme cases she's pointing out. There are very few individuals who do this.
Yes, guys, I'm serious. Bum filler is a thing. I actually wasn't going to include this clip in the video because I didn't want to gross you out, but now I do.
There are doctors who inject a lot in the buttocks. Usually the product they inject is called Sculptra, which usually lasts 2 years, but it gets replaced by your own body's collagen. But some of those really large buttocks that are injected with that, you need thousands of bottles to get there, which would be extremely painful. And injecting that much stuff can cause certainly a lot of problems.
And so then, when the trend changes, and it has, and we no longer like that overfilled artificial moon face look, we then use something like hyaluronidase to dissolve the filler. And we're like, why doesn't my face look good anymore? It is because you have stretched your skin to accommodate the filler. Now the filler is flattened out, it's migrated, maybe you dissolved it, and your skin is left looking a little deflated, which is probably another reason why people think that Gen Z is aging faster. Through no fault of their own, they became the guinea pigs for these tweakments. The generation that was unfortunate enough to grow up just as baby Botox and filler was exploding. And unlike us millennials who were actually old enough to utilize these tweakments without damaging our faces, Gen Z was just a little too young. But filler became so popular that we began using it in ways that it was never intended.
So these are extreme cases. This is like a dozen people who do this. That's really not the average population.
Filler isn't evil. When used correctly, as it was intended, on the right candidate, it's perfectly fine. And if it makes you feel more confident and self-assured, then you go and get that filler. These tweakments are meant to be there to help you, not hinder you, when used in the right way.
I agree with that. I think a lot of people are overdone with fillers and they can get that puffy look, especially in the lips. But I think when it's used in the right way in a conservative manner, it can provide a very nice enhancement and make you look definitely more youthful.
I know people think that I judge women who get filler. I do not. I'm one of you. What I judge is the unrealistic beauty standards that have made us feel shit in the first place. But the fact of the matter is filler isn't going anywhere. Not for Gen Z, not for millennials. It's here to stay. And that's okay. There is a way to utilize filler in a way that empowers you and doesn't ruin your face and doesn't destroy your lymphatic system because yes, guys, in case you didn't know, in case no one told you, if you're getting filler on top of filler on top of filler that never actually breaks down and simply flattens and moves around, it's gonna block your lymphatic system, which is another reason why girls like Kylie and Bella may look a little older than your typical 20-something-year-old.
So right there you can see her whole neck, everything is a lot fuller. It's usually something like that is more attributed to weight gain than necessarily filler, because we're not injecting these fillers in the neck. You can see the picture on the left where she has a nice neckline, and the one on the right is not as crisp because of weight gain.
I probably wouldn't recommend that you use filler to build huge lips that are too big for your face, or a boxy jawline that sits 2 inches below your own.
This is not how you create a feminine jaw. Far too much product's been added to the jawline, There's far too much projection of the chin, almost making it look witch-like.
Or a pointy little chin made out of filler that doesn't really suit the rest of your face.
Well, I agree with those cases. That's just too much filler. They should have been advised differently.
And while we're on the subject of things not to do not get your buccal fat removed. Do you know why Bella Hadid may look older than 28? It's because she doesn't have the puppy fat in her face.
So here, she also looks heavier in her whole face. Part of that is possibly due to weight loss, but I do agree with her that some individuals, especially younger individuals who basically are very gaunt to begin with, should not get buccal fat removal.
That she used to before her cosmetic work. According to experts, Bella underwent a procedure called buccal fat removal, which removes the fat pad under your cheekbones. Now, why the fuck would anyone want to do a random thing like that? Supermodel cheekbones, of course.
So once again, in the right patient selection, I think buccal fat pad can make a nice difference on someone, especially if they have a square, kind of large, puffy face without fillers to begin with.
A few years ago, having sharp, defined facial features that looked like you hadn't eaten in a year and had leapt in a time machine back to the days of Kate Moss and Heroin Chic was all the rage. Now, not so much. Now we all want collagen, glowing skin, facial fat. But if you, like Bella, remove that fat, you can't exactly just go and retrieve it and put it back. And what is one hallmark of the aging process? Thin, gaunt cheeks. Not because we're being mean, not because we're hating on the aging process, because it's a fact. As you age, your face gradually starts to thin out, your facial fat melts away, and you lose collagen in your skin, resulting in hollowed out cheekbones. So when you purposely hollow out your cheekbones, you may look very cool, very supermodel, very trendy, but it will also have the knock-on effect of making you look older than you actually are.
So that's where Botox, fillers rather, and fat grafting to the face can help. Fat grafting to the face can look very natural if it's done in small amounts. And you also want to do it in a person who's stabilized in their weight. Those are the people who are going to lose fat in the face and look gaunt.
Now, Botox is not the devil. I used to be a huge proponent of Botox back in my 20s when I did not need it, hence why I feel like I can sit here now and make this video, because I fell hook, line and sinker for the whole preventative Botox myth. Then I became very anti-filler and Botox, as you guys all know. And now I sit somewhere in the middle. There is nuance to the topic. Do I think 20-year-olds should be out there getting Botox every 3 months? Excuse the French, but no. But I'm also not here to demonize any of you guys who do get Botox. If you are the right candidate and of the right age, and you go to a reputable injector, licensed injector, preferably a doctor who knows what they're doing, and you're in your mid to late 30s and older, if that's what you want to do and it's going to make you feel good about yourself, then girl, get it.
Now that I agree with.
But let's do it from a place of intelligence and not fear. There are ways to utilize Botox as a tool without degrading your muscle tone and in turn your face. Where we used to be encouraged to rush back to your injector anytime you felt your facial movement coming back, a good injector will now tell you quite the opposite, like Shireen Idris.
And we use Botox as the umbrella term, but Botox is a type of neurotoxin. And toxin is a scary word, and so that's why people just use Botox, because you don't want to say, oh, I'm putting a toxin in my face, but you are. This neurotoxin basically slows down how your muscle contracts so that you are giving your face moments of pause. The reason I say slows down how your muscle contracts and not paralyzes you, because paralysis is not the goal. Paralysis, where you're fully flat, not able to move your forehead, is not the goal. You're gonna look older, you're gonna look weird. You want to get these neurotoxins in a way where you still have movement, but you're minimizing that movement. You don't want to be Botoxed the whole time throughout your 40s because your muscles will thin out completely, and by the time you hit your 50s, you're going to be flat, flaccid, and your eyelids are going to be heavier.
So I agree with that, especially if you have a large amount of Botox over a lengthy period of time.
You want your muscle memory to come back. You want your Botox to wear off, and you want to have normal movement in the interim so that your muscle memory can hold on to your face and hold on to your structure.
Which actually brings up the bigger issue here. The issue is not that Gen Z is aging faster than millennials. The real issue here is ageism in general. Can someone please enlighten me as to why we are so damn terrified of aging? Why we try to avoid wrinkles like the plague? Why we literally pay people to cut our faces off and stitch them back on but tighter? Why we inject ourselves with literal toxins?
Because no one likes to look old, you know, and if you can make yourself look younger, there's a lot more confidence, you feel better about yourself.
To paralyze our muscles so that we can stay looking younger for longer? Oh, right. I know the answer to that because it's staring us straight in our faces and we can't escape it. Us females, we are not allowed to age.
That's not really true. You're allowed to age, but you want to age gracefully.
And if we dare to let nature take its course and bless us with saggy skin, double chins, and crinkly eyes, we become obsolete. We fade into the background. If you don't have youth and beauty in this day and age, you have nothing.
That's a little extreme.
So is it any wonder, really, that us ladies are doing everything within our power to slow the aging process down? It's not out of insecurity. It's not even out of vanity. It's out of self-preservation. Quite literally.
Well, it does give a lot of confidence, so there is a level of insecurity there. So everybody wants to look younger. It definitely gives patients a lot of confidence.
Now, is Gen Z really aging faster than us millennials? Biologically speaking, no. Gen Z is not aging faster than us, but it is very possible that over-tweaking the face in an effort to ward off the aging process is actually making young people appear older than they are. It doesn't mean you can't get the tweakments, you are your own boss, but I would encourage you to be smart about it. Choose your injector wisely. Really research any procedure that you want to get done before you get it done. Informed consent, my darlings. It's very important when it comes to medication, to medical procedures, and your face.
So I definitely agree with that. It's important to get good informed consent, good advice, and go to a licensed professional.
Make sure you're aware that fillers don't actually dissolve like we were told. Pay extra attention to your lymphatic system if you decide to get them. Move your facial muscles to avoid atrophy. Gua sha, facial massage. Get that blood flowing, the lymph moving, and the muscles working. And most importantly, try not to lose your beautiful, unique, individual beauty in the process.
Thank you for watching this video. I hope you enjoyed it. And if you like these, hit the like and subscribe button, and there'll be more on the way.